Hi there! Welcome back to SG Dr. Wellness, your medical information channel with new weekly videos. My name is Dr. Chen Yiming. This week I'll be talking about male pattern hair loss, otherwise known as androgenetic alopecia. This is a huge problem that has disturbed many of us guys, and in this video I'll be sharing about the pathophysiology of male pattern hair loss, who are at higher risk of getting it, and the treatment available to reverse this condition. So watch till the end to find out more. And if you're new to our channel, click on the subscribe button now. In a normal healthy head of hair, the follicles on our scalp can be in three phases. One, the anagen phase, is known as the growth phase. About 80% of our hair should be in this phase, and it lasts a good 3 to 5 years. The hair is receiving good nourishment from our blood circulation and is constantly growing. Next, the catagen phase, otherwise known as the transition phase. Only a small amount of hair are in this phase. This is a short 2 weeks transition stage where the hair is detached from the follicle and the blood supply, and the growth of the hair actually stops. Number 3 is the telogen phase. About 20% of our hair is at this stage, and it can last for about 2 to 3 months. This is the phase where the old hair drops off and new hair starts to grow. From the telogen phase, the follicle will transit back into the anagen phase again. So like a circle of life, our hair follicles will move through these 3 phases repeatedly. So now let us take a detailed look at what happens in male pattern hair loss on a molecular level. The male hormone that is responsible for causing hair loss is testosterone. Testosterone is converted into dihydrotestosterone by an enzyme called 5-alpha reductase within our body. This dihydrotestosterone, DHT for short, will bind to the hair follicles and cause accelerated conversion from anagen phase to telogen phase, meaning more hair fall and lesser hair growth. Over time, it will cause the hair follicles to shrink in size, and as a result, the hair becomes thinner and finer. And finally, the hair follicles will close up and stop producing any more hair. The longer this process is allowed to continue, the more irreversible the condition becomes. So treatment has to start as soon as you notice increased hair thinning. So who are at risk of male pattern hair loss? Those with a positive family history. If we have a close relative with male pattern hair loss, for example our father, our uncle, then our risk of suffering from it is higher. Age plays a part for sure. The older we get, the higher the chance of androgenetic alopecia. Now, there are different classifications to the stages of male pattern hair loss. One that is commonly used is the Norwood-Hamilton scale. We use this scale to help identify which stage our patient is at, and it also shows the severity of the condition. In stage 1, there is a mild recession of the frontal hairline, and from stage 4 onwards, there is balding seen at the top of the head, an area called the vertex, and at stage 6 and beyond, the frontal recession will meet with the vertex hair loss, and in stage 7 is the worst, where the patient will lose all his hair at the crown. Now let's quickly zoom into the treatment plan, the highlight of the video which I'm sure you're waiting for. What are the treatment options to reverse this? I would subdivide them into 1 topical application, 2 oral medications, and 3 treatments. The only proven topical application that helps will be minoxidil spray. The exact mechanism of minoxidil is not determined yet, but animal studies found that it could potentially shorten the dying phase of hair follicles and prolong the growth phase. It has also been shown to increase the size of the follicles. It can potentially improve hair growth in men over 6 months, following which they have to use it for the long run. It can occasionally cause temporary hair loss for the first 2 to 3 months, and sometimes scalp irritation and itch. The oral medication that we often prescribe is finasteride with the brand name called propecia. Propecia is only licensed for use in men. What it does is that it blocks the conversion of testosterone into dihydrotestosterone, and in doing so, prevents the premature thinning of hair and premature closure of follicles. It is a very effective treatment, but there are some side effects to taking this medication. So please have a detailed consultation with your doctor. Some of the treatments that may be used in conjunction with minoxidil and propecia are lasers. Low-level laser therapy has been extensively studied, and this low-energy rate or almost infrared light can be applied on the scalp daily, and that has been proven to be a very safe method in stimulating hair growth. In recent studies, there are also exploration into using semi-ablative fractional lasers in the treatment of male pattern hair loss. Hair transplantation. The most invasive treatment of all would be hair transplants. When all else fails, patients may wish to consider this surgical approach. There are some newer methods of treatments that are being evaluated, such as PRP or platelet-rich plasma injections, engineered growth factors injections. These treatments are currently being studied and evaluated, and I'm excitedly watching this space closely. Having a full head of hair does wonders to the confidence of a man. Understand that male pattern hair loss is usually genetical, and seek consultation and treatment as early as possible, as treatment success depends on the early stage of diagnosis and intervention. I hope that this video was beneficial to you guys out there, and if you are a lady watching this, share this with your spouse suffering from male pattern hair loss. Click on the subscribe, like and share buttons. Till the next time, stay safe and stay healthy.